Thank you very much. I welcome you to this program today. And I want us to talk about the state of affairs of our hospitals in Kenya, taking into consideration that we have a lot of problems with the events that are taking place in our country as regards number one, the doctor strike, the coronavirus, and many issues surrounding the hospital. Many questions have been asked about hospitals, especially in Africa. And our realization is that our leaders are not interested in developing the manpower of our hospitals. And what would have been very important in our country is developing the software, not the hardware, because the software will deal with the manpower. I have visited several institutions in our country. I've gone to several hospitals, and you find the situation in our hospitals is pathetic. Our doctors are not well taken care of. We have equipment in the hospitals that do not operate. They are unpacked. Nobody talks about them because there's no manpower to operate the equipment. It is unfortunate that we can be able to develop big hospitals, which are just buildings, without the infrastructure. I mean, why would you buy equipment where no one can be able to operate? Why would you have ICU, intensive care units, with all the facilities, but we don't have the right manpower to operate the ICUs? Are our leaders only interested in showbiz, showing big infrastructure, and we do not take care of what is supposed to be taken care of? The doctors, the nurses, the medics. For the last 3 weeks, many Kenyans have suffered. Many people have lost their lives. And they have lost their lives because they could not get the right treatment. There are no people to treat them. Now, my question is, why would we keep on having hospitals that are just shells? Hospitals that cannot treat our people, hospitals without medicine, hospitals without facilities. So basically, in my view, we need to develop proper infrastructure. We need to train manpower. We need to rethink our strategies about training our doctors, our nurses. We also need to think of whether we need the hardware, big buildings without personnel, or we need the software, because I believe we can treat patients even without the buildings. The buildings buildings are part of the hospitals, but they cannot work for us if we don't have the right personnel. Now, has Kenya trained enough doctors? My answer is no. We have the recommended number of doctors according to the World Health Organization. But in our hospitals, you find many of our hospitals do not have qualified doctors, enough based on the ratio of patients to doctors. Now, if we think about hospitals, we must also think about the infrastructure of taking our patients to those hospitals. Many times, many patients have died on the roads because they cannot reach the facilities. We have serious problems in counties like Nyandarua in Kenya, where roads are in pathetic state. Now, I remember in July this year, we had problems with blood bank in JM Memorial Hospital. This is not a case of one hospital lacking blood. But this is a case of almost all the hospitals in Kenya not having sufficient blood to cater for our patient. I think we need to become more serious about the way we look at the general infrastructure of our hospitals. So basically, what do we need to do? We need to learn lessons from the past. We need to learn lessons from the time Corona came to Kenya, when we lost our first pilot. A pilot who has been trained for so many years, yet he dies of a disease, which if we were careful, probably the pilot would not have died. Kenya has lost so many doctors, nurses, medical personnel, due to lack of personal protection equipment. We need to rethink about our strategies. We need to change the way we do our things. We need to become serious in the way we train our doctors. We need to know how many doctors can be able to work in our hospitals and satisfy the demand. Thank you very much.